Could you give us an example, please, of a miracle that's been accepted as official by the Church, the experience of the person before they came to Lourdes and afterwards, and what transpired?
I think it could be very interesting if I gave you the story of Mr. Vittorio Micheli, an Italian of northern Italy. He was doing his military service in the Alpini. When he was 23, in 1962, he came to Lourdes as a pilgrimage that his family, his mother most particularly, absolutely wanted, because he was basically dying of a cancer which was of course not curable. We are in the early 60s, there's no treatment for cancer at that time, and the military doctors didn't want to send him out because he was basically dying. His lower left limb, his left leg if you want, was attached to the trunk only by the skin and some muscles, because there was no more connection between the pelvis and the femur and the leg. We have x-rays of that. Biopsies and histology confirmed that he had cancer. There was a sarcoma of his pelvis. So against all advice, his mother was able to bring him to Lourdes in pilgrimage, and eventually she asked, I must say, because she has told so, we have all the reports, that she came to ask for his son, 23-year-old, to be cured. Now what happened is that Mr. Micheli was indeed cured, and his cure, which followed the times of biology, which about 2 to 3 years later, after 1962, the anatomy of his pelvis and the head of his femur were rebuilt, and again in a normal anatomic relation, although there is a hiring, if you want, of the level between left and right side of a few centimeters. Now, what is interesting of this story, this can help me explain what are the criteria, the very severe criteria that we try to follow here in Lourdes. First of all, we would search the cure of a disease with severe prognosis. Our second criteria is to search for is to make sure that we are in front of a disease which has been cured, but of a disease that had a certain diagnosis. We were sure of the diagnosis. Our third criteria would be that this is an organic disease. It's a mainly organic disease. In other terms, we know that there are psychiatric and psychological conditions that can be cured, that are cured, if you want, in places of religion, but we also know how difficult it is to measure in an objective way, and with objective means, a psychiatric or psychological condition, organic. A fourth criteria is that we want to be sure that no treatment, no therapeutics can explain or could be put in relation with that outcome, the cure. Our fifth criteria is that this cure has happened in a very instantaneous and sudden way. Our sixth criteria would be that this cure is complete, and the seventh and last, that this cure is durable in time, is permanent. Now, the case of the cure of Mr. Micheli responded actually to these criteria, and it was 7 years later that the International Lourdes Medical Committee, on the following, let's say, the analogous decision of our bureau in Lourdes, indeed concluded around a written report by a professor of oncology at the time that this cure was indeed unexplainable, unexplained, and exceptional. So this dossier was then handed out by the Bishop of Lourdes to the Bishop of Trento in Italy, and as it happens every time that we come up to a final conclusion after about 10 years that this is an exceptional cure. And it was the Archbishop of Trento that autonomously came out with his decision and has recognized this cure as being a miracle.